I'm going to take a look at your hand in just a moment, okay? First, I do need to fill out some paperwork with you, okay? Okay, we know what you're being seen for today, which is a hand laceration. And how long have you had the symptoms? You injured yourself this morning? Okay, about how many hours ago? Okay. Yeah, I'm sorry, the emergency department, the waiting list can get quite intense. So alright, these questions are kind of tricky in terms of your situation. So I guess, let's see. Did you notice any redness around the cut? Okay, and a little bit of bruising. Swelling, okay. Any fever, chills, or sweats? Okay. How about any loss of consciousness, dizziness, confusion? And do you have any injuries anywhere else? Okay. And then we know what caused your symptoms. We'll just say gardening accident. Okay. And do you smoke? Have you ever smoked? And do you drink? Okay. Any current medication, supplements, or vitamins? Okay. And any history of having surgery? When was that? Okay. Any allergies to drugs, food, environment, or chemical? Iodine, okay. Alright. Hey, I'm allergic to grass too. It's kind of an awkward one when you want to go out to a park or anything. It's okay. Now we're going to go through a list here, and I'm going to ask if any of these conditions apply to you or any family member, okay? Okay. So acid reflux. Yeah, the omeprazole. Okay. Alcoholism. Aneurysm. Okay. Anxiety. Asthma. Blood clots. Cancer. Your aunt, okay. Depression. Emphysema or COPD. How about gout? Okay. Any headaches or migraines? Heart attack? Hepatitis? How about high blood pressure? High cholesterol? Kidney disease or kidney stones? Okay. Liver problems? Lupus? Obesity? Osteoarthritis? Osteoporosis? Rheumatoid arthritis? Seasonal allergies? Yeah, I think everybody checks those. Seizures? Sleep apnea? STDs or HIV? Okay. Stroke? Substance abuse? And thyroid problems. Okay. And then most of these we don't need to worry about, but have you had a tetanus shot in the last 7 years? Okay, 4 years ago. Okay, so that was... Gotcha. Alright, so then I think we can go ahead and get on with it. So, if you can just rest your hand right here for me, okay? Okay. So, are you okay if I remove this bandage? Alright, try to be as gentle as I can. Oof. That is looking pretty uncomfortable. So, okay. I want to numb you, but first I do need to remove some of these larger bits of, I'm assuming this is gardening soil. Okay, so I just want to see how tender these areas are. It'll also help me assess if there's any kind of nerve damage, alright? But it'll help me decide if we need to use a topical before I start cleaning. So, how's that? Okay. Here. And there. Okay. If it starts getting to be too much, let me know, okay? this one might be a little spicy, but this is a very big piece right here. Okay, so I know, I'm sorry. Alright. Don't want to risk any of these bigger bits getting stuck underneath the skin, so so this is Bactine, and as you can see, it has a 4% Lidocaine, so it should help and do a little bit of a topical numbing, and then as I get this a little bit more clean, we will use an injected, but I don't want to introduce any kind of bacteria or foreign bodies deeper inside of the area, so we're going to start like this. Okay. I'm going to be as gentle as I can, okay? So sorry, but I see some bits that I need to get out. Try to take some deep, deep belly breaths, okay? Pretty good size piece right here. Alright, I'm going to try something, okay? Okay, I'm just going to clean up just a little bit more around the edges. Well, I got a little bit of blood on you, but the dirt is gone. So, okay. Before we go further, I am just going to inject a bit more numbing solution, okay? And don't worry, the alcohol is not going to go on your skin. Because I know that would be very unpleasant. So the first injection is probably going to have a little bit of a sting to it, okay? But then it should numb up pretty quickly. So, you ready? Okay. So here comes a little bit of kind of a stinging burn. You did great with that. I know it's not the best experience. It's okay. Can you feel that? How about there? Here? There? Okay. And here? Alright, good. So, looking at the size of this laceration as well as considering the placement, I do think that you're definitely going to need sutures to get this closed, because even when we are not conscious of it, we use our hands. Are you right or left-handed? Okay. I think that if we were to do a butterfly closure, you're gonna still end up pulling this open again. So I think sutures are the way to go. Because also if you do start using the hand, the sutures will pull and let you know real quick. So this won't burn or anything. It's just going to really make sure this is nice and clean. It's an antibacterial cleanser. Let me move this step. Okay. So you will feel some pressure, but it should not be painful. If at any point it is, let me know and I'll get you more numb, okay? Okay. Oh, come on. One down. All right. So that is number 2. Whoops. Thought I had that in a better placement. Alright, this one is being troublesome. Get over here. Alright. So it looks like you're a bit of a bleeder, which is okay. I just want you to know if you are looking that it is not uncommon. Some people see that and kind of panic. So we have 3. I think we're gonna do 5 total, okay? So let me just quick peek here because I think I see. I did put that here so it doesn't get in the way. On the offhand, we need it again. Alright, we're going to do number 4. Alright, so we have one last one to do. And this one can sometimes be a little bit awkward, so we're going to do our best here. That actually went quite smoothly. I feel like if I prepare myself for failure, well, not failure, but just for something to be difficult, it always ends up surprising me, versus if I anticipate that something's going to be easy, then it's like, haha, nope. All right. Let's get this trimmed. Get that out of here. Get you out of here. And now let's do a little bit more of a cleanup. Alright, so now I'm going to apply some antibiotic ointment and pop my knee. So I'm going to need you to keep your hand there for just a little longer. So we will be sending you on your way with a prescription for this ointment. And you're going to want to gently dab it on the cut, even over the sutures, just once a day. I don't want you to do it twice a day because we don't want to risk the skin becoming macerated, which is basically like, you know, when you're in the water for a long time, how it gets pruny. Yes, that. Because it can make it hard for this to close, and also it can make the sutures sometimes pry loose. So, don't want that. So, just like a thin layer here. I'm doing it a little thicker than I would have you do just because it's fresh. And this is also going to help and prevent some of the potential of scabbing over the sutures. But if it does scab a little bit, that's okay. We can get that cleaned off for you with a little bit of hydrogen peroxide. But let us do it, okay? And then I will be prescribing you a topical antibiotic to use as well. So then this is a silicone gel dressing. You can kind of see that through the paper. and it does a really good job of protecting cuts. So we will be sending you home with a box of these, okay? Okay. And actually, this box oops, sorry honey, this box has plenty, so we'll just send you home with this one. So as you can hear and see, this has quite a big cushioned area, so it's going to keep things comfortable, and it's also going to protect the area if for some reason something should touch or bump into your hand. And it's going to be a little bit big and awkward, but I want to make sure it adequately covers. So I'm going to put it actually at an angle. Just like so. And then what I recommend doing is taking part of the wrapper and using it to create some friction along the part that is adhering, because it can be difficult to keep a bandage on here just because our bodies create oil and sweat. This will keep it from peeling up. And then I'm also going to put a few pieces of tape just to really make sure. I'm actually going to put this kind of like so and tuck it around. I feel like when people have something that they feel kind of holding their hand, they tend to make a point of being more careful, because like I said before, it's very common for people to just accidentally move your hand. It's a body part that us interact with the world, so makes sense. I'm just using some friction to make sure everything stays put. Okay, so now I can also wrap this in some Curlix, which is like a gauze roll, if you feel like maybe you need some extra protection. Okay, so what I'm going to do is just never mind. I thought we had some in here. And evidently I was hallucinating, so... nope. No, I was not. I found him. Okay. So I'm gonna leave this just right here, okay? So if you want, you can take that with you, and or if before you go you decide that you want this extra protection, in a moment I'm gonna send a discharge nurse in here, and she'll go over some paperwork, and if need be, she can also apply this for you, okay? Okay. Do you have any questions before I step out? Okay. Well, then I'm going to go talk to one of my nurses and provide her with some prescriptions to give you, and then she'll go over all that information with you as well as discharge instructions, okay? Okay. So if for any reason this starts getting red, and it's like expanding beyond where it was, or you see it streaking up the arm into the fingers, if you start noticing any kind of finger swelling, or this getting really swollen, or you see any drainage that is not just like blood or clear drainage, if you start having any kind of fevers, chills, night sweats, I want you to come back in here so we can reevaluate you right away, okay? Okay. Do you have any questions for me? Alright. Well, if you happen to think of anything before you leave, just let someone know and I can come back in here, okay? Okay. So then I do want you coming back in here in 2 weeks so we can remove those sutures from you, alright? Sounds good. It was nice to meet you, though I'm sorry it was under these circumstances. And you take care.